Hi, I'm Dr. Danielle Gentile, a health services researcher in the Department of Supportive Oncology at Levine Cancer Institute. And I'm here today to talk a little bit about my research interests. This video could be for a wide audience. It might be fellow researchers, administrators, clinicians, or patients. So first and foremost, my primary interest is in integrative oncology, more specifically non-pharmacologic pain management, which means finding ways to cope with pain without medications. So we know that a number of ways that pain can be treated often uses medication, which is helpful, but sometimes comes with unwanted side effects. So integrative oncology uses interventions like yoga, healing touch, oncology massage, acupuncture, meditation, and so on. And these things can help people to cope with their pain and hopefully not experience too many side effects. My other interest is in social media for patient engagement. We know that patients who use social media to reach out to others who are coping with similar illnesses, they can find ways to vent their frustrations, share their triumphs, look through information about how to best take care of themselves. Those patients tend to fare better. But of course, social media, like all things, is not a panacea. Sometimes it can cause patients to become distressed because of all the information overload or just finding too much interaction a little bit stressful. So we recommend that patients use social media only to the extent that they feel comfortable. I'm also interested in culturally competent healthcare for LGBTQ patients. So LGBTQ cancer research, there is still a lot to be found. And I'm interested in culturally marginalized groups because we know that they tend to have worse health outcomes and experience events within healthcare that are contributing to those poorer outcomes. So my hope is to be able to research and improve care for LGBTQ cancer patients. I'll next tell you a bit about a few projects that I have been working on and plan to work on in the future. First is my very first randomized controlled trial about acupuncture for multiple myeloma patients who are experiencing chemo-induced peripheral neuropathy. So chemo-induced peripheral neuropathy is an uncomfortable sensation in usually the hands and feet, and it's like a tingling, burning, sometimes very painful sensation that can really lead to quality of life issues. So previous research has shown that acupuncture can be helpful for chemo-induced peripheral neuropathy, but there is not any work yet in the multiple myeloma space, and so this has led me to be interested in that area, and we've designed a trial to test it. Next, I have recently completed work on a manuscript with colleagues from the Society of Integrative Oncology Research Committee to give a position statement about patient-reported outcomes for pain. So pain is a very complex quality of life issue, hence my interest in it. And there are many ways that clinicians and researchers might ask patients about their pain. So because there are so many different measures, this can lead to trouble with comparing outcomes across studies. So our statement paper guides clinicians and researchers to hopefully use a more uniform way of collecting patient-reported outcomes in pain. And since this has been successful, next we are going to do a similar paper on fatigue. How is fatigue measured, and how can we get more consistency across studies in patient-reported fatigue outcomes? I'm also a co-investigator on a Hearst Foundation grant, and my role on that grant was to film a video and provide resources about non-pharmacologic pain options. So I talked a bit about those things I mentioned before, like acupuncture, yoga, guided meditation, and a portion of this project will have patients using virtual reality. So practicing putting on headsets and escaping into more relaxing worlds, like a relaxing beach scene or a place anywhere across the world to provide some distraction from one's pain. So I'm very interested in how virtual reality might help cancer patients with their pain. And again, this is an area that has a really bright future for a lot of novel future research. So that is a short bit about me and my research interests. Thank you so much for watching and hope to stay in touch. Thank you.
Thanks for watching. For more information, visit us online, send us an email, or give us a call. Don't forget to click subscribe and hit that notification bell so you know when new videos are released. And most of all, be well.